Hi, thanks for joining this workshop for Elbow Conditions Priority Setting Partnership, or PSP as it is called. I'm Harvinder Singh. I'm an elbow and shoulder surgeon in Leicester, and I'm the PSP clinical lead. And in this video, I'm going to tell you about the background of the project and what we have done so far. There is a separate video from Jonathan Gower, who is our James Lynn Alliance or JLA advisor, who is going to tell you about what to expect during the workshop on November the 24th and what you need to prepare in advance. So, BES, or British Elbow and Shoulder Society, and British Orthopedic Association, and Leicester Shoulder and Elbow Unit Charity are the organizations who have supported this project, and they promote research and care for patients with elbow conditions. Now, previously, research and funding has focused on shoulder and hand conditions, so it has become harder for researchers to design large randomized trials on elbow conditions. But to tell us how we should treat these conditions, there has been a realization recently that elbow conditions should also become a focus of big research projects. And these conditions do affect the patient's life quite severely. Now is the time to develop research priorities, because these conditions also can be life-changing, and treatment of these conditions can be challenging, and they have additional challenges for recovery for patients. So James Lynn Alliance agreed to set up this priority setting partnership. And JLA as an organization is independent, and they are committed to the principles of patient voice and transparency. So that means that funds from the charities and the NHS are simply not going to answer questions posed by one or two surgeons or researchers, but the research priorities are reflecting the whole scope of patients affected by these conditions and those who take care for them. So the first priority in this condition for elbow conditions PSP was to set up a steering group. This included patients with lived experience of elbow conditions, and also healthcare professionals from different backgrounds like orthopedic surgery, elbow surgeons, trauma surgeons, physiotherapists, and also rheumatologists and sports medicine doctors. This is our first picture from the only face-to-face steering group meeting that we've had in this PSP because of the pandemic. So during this meeting, we deliberated the scope of this PSP. And part of that we did was we looked at previous research and other PSPs which have been done, and made sure that there wasn't too much overlap with our PSP. Then we also looked at all the conditions that could affect the elbow joint in particular, which are listed here, like osteoarthritis, inflammatory arthritis, tendinopathies, stiffness, instabilities, ulnar pathology, tendon problems, fractures and dislocations. We did include also congenital elbow conditions, referral pathways, and natural history of the disease and the long-term outcomes. We did have some exclusion criteria like diagnostic techniques and investigations and prevention of elbow conditions, which could be part of a different PSP in future. So initially, we launched our survey, which was back in 15th of January 2020, and this carried on for up till 31st of July. This was sent out in online and paper forms, and was promoted through social media and also through hospital using outpatient clinics as a portal. So we asked patients and clinicians and also other healthcare professionals to tell us what should be the research priorities. We gave them these free text boxes, but also we prompted them to tell us about their hospital treatments and their own stories about their treatments of undergoing elbow conditions. And we distributed these questionnaires, surveys to patient and professional national bodies as well to get the maximum response. So we received in total 467 responses, which came from 154 respondents, including 48 patients and carers and 106 healthcare professionals. These responses were grouped further into 46 summary conditions of questions, and these questions were searched in literature to ensure that these were not previously looked at and have not already been answered. These are the map of responses where we got from other countries and also throughout a distribution in United Kingdom itself to cover all the countries. So these questions or themes settled into different themes further, like elbow osteoarthritis, tendinitis, inflammatory arthropathy, elbow stiffness, ulnar nerve problems, and chronic elbow instability, tendon ruptures, especially the biceps tendon ruptures, and also acute elbow fracture and dislocations. So from these 46 questions, then we launched our interim survey. This was launched on the 1st of April, 2021, and it carried on till 31st of August, 2021, to ask people to choose their top 10 questions out of these 46 responses that we should take forward to our future meetings. We asked again patients and healthcare professionals. This was promoted through social media, and also patients and professional national bodies, even national golf societies and also tennis association, to ensure that we can catch the wide audience. This was on online and on paper-based surveys, detailing these 46 responses. So the responses from the interim survey, we received 240 from 67 patients and carers and 173 healthcare professionals. And these were more from healthcare professionals, and we wanted to make sure there was good balance between professionals and patients. So what we did was we got the top 10 responses from the patients and carers and the top 10 responses from the healthcare professionals, and we merged them so we can get a final balanced 18 questions, which we'll be discussing at a final workshop on the 24th of November, 2021. And this is the map of all the responses with interim survey, something we have been looking at thoroughly during the process to ensure that opinions we are getting have an appropriate balance and is spread across the whole of the UK. So the final workshop, we have mentioned, there is another video from Jonathan Gawa, who's already probably have watched, which involves what we are expecting of you on the day, but broadly speaking, where they come together is to produce the list of 10 top research priorities that will we take forward to the funders, and that will inform the future research on elbow conditions. And ultimately, that is going to mean that in future, we are going to have the best chance of answering questions that the patients and their carers want to be answered so that they can have the best care and the best outcome in the long term. Okay, thank you for listening to me and going on for the future. I'm really excited to see you all, meet you all on the 24th of November. And I would just like to thank you for participating in this PSP.